So today we're going to be using heat thermal agent on our 17-year-old patient Jake, and he is currently 6 weeks post-op after being immobilized in a cast, so he's probably in the end stages of the fibroblastic repair. So some contraindications for using the heat as a thermal agent would be if they have a hemorrhage, if they have malignancy, if they are acute. We don't want to put that right there. Some indications for use is to improve range of motion, to decrease pain, to alleviate muscle spasms, and there's lots more contraindications and some other indications for use as well. So we'll go ahead and talk to our patient here. So we'll get him laying down. He's after his therapy treatment today. So we're just going to kind of describe to him what's going on. So on this knee here, Jake, we want to put some heat there to kind of help. Actually, we're before treatment. So he doesn't have very much flexion, so we want to make sure to get some flexion before, get that knee bending before we start any treatment or anything. And so we're gonna place some heat on that knee just to kind of help loosen things up and to get you ready to do some exercises and stuff. Does that sound okay to you?
Yeah, it sounds good.
Okay, so what I want you to expect, I want you to, it's gonna be warm. I don't want it to burn or to get too hot. If at any point it does get too hot, we can just take that off. And so we'll get you set up with that now.
Okay.
I'm gonna pass this to you. Okay, so we have our, not actually hydroculator, but we have this here. So we'll go ahead and remove one of these packs from here. And we'll place it here. This top one will count as 2 layers. And then we have another 2, 4. So now we have 2, 4, 6, and then I'm just gonna place another layer here, and we'll go ahead and get this onto our patient here. And I did inspect the skin before, so we noticed that there's no redness or anything. And go ahead and just tell me, can you feel my finger here?
Yeah.
Okay.
Yep.
All right, so then we should be good to place this on the knee here. And I'm gonna have you just lift this leg up for me, and we'll tuck that under. Good. And then we'll tuck under this one too. Perfect. How's that feeling?
Pretty good.
Okay, cool. And so now we'll just let our patient relax here. And if I were to leave the room of this patient, I would give them a bell. And as I'm leaving, I would set a timer on my watch. So Jake, we'll go ahead and leave you on here for about 15 more minutes. Here's this bell. Go ahead and ring that if you get uncomfortable, and we can come and take this off. And if it gets too uncomfortable before you can ring that, go ahead and just kick that off of your knee there. And then I will go ahead and set a timer for 5 minutes, and I'll come and check on you in 5 minutes, okay?
Okay. Great.
Perfect.
5-minute timer. Counting down.
Okay, then after 5 minutes, I'll come and inspect my patient, check in with them, make sure everything's okay. How did that feel, Jake?
It felt good.
Perfect. Okay, and then we inspect again, make sure that there's no burns or anything like that, and it looks good.